record. So we are officially spotlight Mark. I will spotlight myself. Amazing. So we are back for another Fireside Chat here with the Grateful Giraffes. Today it is an honor and privilege to have Dr. Mark Shortt with us on the show, who will be covering a lot of interesting topics in the field of psychedelic therapy. Welcome to the show, Mark.
Thanks. Great to be here, Max.
And maybe we can just start off with a bit on your personal background, how you ended up, on the journey to this field, and what what you're up to these days, and then we'll jump into some amazing questions.
Absolutely. Yeah. So it was I wouldn't say a straight shot. It was kind of a non-linear journey for me to get here. And I would say my interest in psychedelics probably started when I was in college and in Montreal and had the opportunity with some of the guys there to take mushrooms and go hike Park Mount Royal, which, if you know it, is iconic. And we had a really, I think, pretty classic trip. We started off in someone's home, listening to Pink Floyd, Animals. It was amazing. Then we went and walked to the park, listened to the drum circle, had fun lying in the grass, and we continued to hike up the mountain. And then at one point, just around sunset, we found ourselves on this ledge overlooking the city of Montreal. We could see the river running through. It was gorgeous. And we sat in a circle and we started kind of talking about our lives. It was the end of the year, the school year, and talking about the next year and what it was going to be and what we wanted to be and what the challenges we were facing were. And everyone went around and kind of talked, and the whole circle held space for them and just heard what they were saying and offered empathy. And it struck me because it was such a caring and intimate space, and I hadn't experienced that in a group of men before. And so it left a really lasting impression, and I felt very grateful to be part of it and also proud of us for holding that space for each other. And so I think, without knowing it, that might have been my first experience of psychedelic group therapy. I'm not sure if any of us realized in that moment, but it had that impact. And so I felt the intention that could be in, even though it was recreational, so to speak, it was also kind of deeply moving and therapeutic. And so that clued me onto something, even if it was subconsciously at that time. And then I ended up going to school for naturopathic medicine. So naturopathic medicine is like holistic medicine. It's still, the 4-year medical degree and getting licensed and all that. And throughout school, I had 2 friends, really good friends, that we didn't get to see each other that often. So maybe 1 or 2 or 3 times a year, just for a few days at a time. And we really wanted to make the most of our time. And so pretty much whatever psychedelics we could get our hands on, we would do and just spend, 8, 10, 12 hours together, really dropping in with each other. And at first, it was kind of about having fun and what we could get up to. But over time, it seemed at one point we always made time to do a similar thing, sit in a circle, hash things out, make decisions about our lives, and then we would hold each other accountable to them when we talked next and say, hey, this is what you said in that moment. How's that going? Whether it was career or where we want to live or relationship, we really took it seriously, and I would say even sacredly, though we didn't call it that at the time. And at one point, one of our friends went to join the army, and he was in combat. And so we were only able to see him once, maybe twice a year during those years. And after he came back, he, it was understandably challenging to reintegrate into civilian life. And I'd say over about 2 or so years, a lot of which we were doing MDMA when we got together, we really processed things and we really talked about it and we really supported each other. And he attributed that process as part of what really helped him reintegrate. And he's doing great now. He's a top doctor. He has a family, just really doing so well. And so I firsthand got to witness the power of that and the kind of the power of the psychedelics and the interaction that we were doing over that time. And I distinctly remember this one moment where I had this insight, oh, this is a good thing. We feel good. We're doing things that are really good for ourselves and each other. And this is actually really helpful and beneficial for us. And in that moment, I said, I think I want to advocate for this. I felt this real sense of justice. How can this be illegal to be in this mindset that is actually so positive, so beneficial? And so I said, I'm going to spread the word. I'm going to tell people. And hopefully one day this will be something that is, more accepted socially and also legally, because I want people to have access to this. And the fact that it's illegal already cuts so many people off from access about that. And then it was after I graduated and got my license when I met the friend of one of my colleagues, a doctor, and he said that he was going to do a training with Phil Wolfson, a kind of pioneer in ketamine therapy in Berkeley. It was the first training they were giving. Would I want to come be his partner for that training? I didn't even know ketamine therapy was a thing at that point, but I said absolutely yes. So I did what I needed to do to get down there, and over the course of 2 weekends had this incredible, and I would say life-changing experience of being both getting trained both how to practice this work, as well as it was an experiential training. So we're getting to experience it, just feeling what a privilege it was that I got to do this deep work on myself as part of my training, and then to get to offer that to other people. And so I was really fortunate. One of the other facilitators at the training had a clinic down in the Silicon Valley, asked if anyone was interested. I said I was. I went to check it out. We really got along. She invited me to come work there, and 3 months later, I moved from Seattle down to the Silicon Valley. And that was in 2018. And so I spent the next 2 years working there, doing ketamine therapy every day, helping out with the trainings, going to all the conferences. And that, I'd say, was kind of my deep dive and my residency in psychedelic therapy.
Beautiful, beautiful start to this conversation. Great to learn where it all came from. And maybe we can just start with a few definitions. So how do you define psychedelics, and how do you define psychedelic therapy?
It's a great question. So if you look at kind of the etymology, the meaning of the words for psychedelics, it's mostly translated as mind expanding or mind manifesting. And I think that's a pretty appropriate term for it. For me, psychedelics, what they do is connect people more to themselves and to their inner world, as well as at the same time, often generating a sense of connection to others or even everything that is. And so there's both a sense of deep self-connection and unity connection, or sometimes people call that a unity consciousness with all of existence. And so I think the psychedelic experience can range anywhere on that, from deep personal insight to feeling at one with everything, or anywhere in between, or all of those things at once. And in terms of so I'd loosely define a psychedelic as something that can kind of initiate or evoke that experience or catalyze it. And that can be a substance, and most commonly it is, but it doesn't have to be. People can get there through breathing, through prayer, through fasting, through silence. So the psychedelic experience, I think, can be accessed in a number of different ways. And substances just happen to be one of those ways. And so the therapy part, I would say, is
Yeah.
using, sorry.
I was just gonna restate the therapy question.
Oh, okay, yeah. So the therapy part, I would say, is um, making the most of that psychedelic experience, so that expanded state or that deeply connected state. And rather than treat it as an isolated experience, wow, that was something, I experienced that in that moment, to actually take any insight or change or benefit that comes from that and begin to weave it into your day-to-day life and be able to take what was able to be accessed in that moment and continue accessing it, so that it has lasting and positive changes and benefits. And so that process we call integration.
Cool. And now maybe, your professional area of focus seems to be ketamine therapy. Maybe you can talk a little bit about the differences between ketamine therapy and other psychedelic therapies.
Absolutely. So ketamine currently is the only psychedelic that's legal for clinical use outside of research. And so, there's more and more, which is great. States are kind of decriminalizing certain things. So it's now not illegal to have mushrooms in some states or other plant medicines. Typically, it's the plant medicines. And so people can access them and use them. But from a medical and therapy perspective for licensed providers, um, it's only possible to recommend something that's kind of medically approved. And so ketamine currently is the only approved drug or medicine for clinical use. There's some others that are in the research process, like MDMA, and it's currently appropriate for research medical use. And some clinics even have um, the license to use it in kind of an extended care kind of way. So it's an experimental therapy, but most, I'd say most medical providers in the country can't prescribe someone MDMA at this time, whereas ketamine they can. So that's kind of what separates in terms of how it can be used is it's totally justified in medical and clinical use. Does that answer the question?
Yes, to some degree. But maybe, talk a little bit more about the effects of this psychedelic versus others and, how how different the, type of experience would be, on ketamine versus some other longer experience, for example.
Absolutely. So you started to mention one thing that is notable about ketamine is, the duration of the effect lasts anywhere from, 45 minutes to 2 hours for someone, depending on kind of what format it's in. So the route of administration, um, how many doses you do in a given session, how each individual metabolizes it. So it tends to be a shorter duration than a lot of the psychedelics, whether some are 4 hours, 6 hours, 8, 10, 12. So in that sense, it's pretty appropriate and digestible for therapy use, rather than an MDMA session, which may last 6 hours, um, or more or less. Um, you could have a solid ketamine therapy session with someone in 2 to 3 hours. And so um, just durationally, that's one thing of note about ketamine. In terms of the experience, a lot of people ask me if I could use if they were all legal for use, or if they're all sanctioned for clinical use, would I use them? And I would, but I would still use ketamine because I think it's so valuable and so versatile. Um, for some of the other psychedelics, MDMA, for example, has a pretty, I would say, distinct flavor or signature. You pretty much know what you're going to get. It feels like MDMA. Mushrooms, a little bit more variable, but still very much has the signature of mushrooms, LSD, etc. Whereas ketamine, I found to be it has a lot of variation. And even the same dose in the same person on a different day can feel vastly different. And some people have reported an experience similar to mushrooms or similar to MDMA, similar to ayahuasca even, and or its totally own thing. And that's one thing that I am just so interested in and love working with ketamine for, is that it has this variety of experience and it can be so different for people. If I had to try to explain it, one thing that characterizes it tends to be a sense of safety. And in that sense, it's very gentle because most people have what feels like a very safe and pleasant experience of ketamine. And that's due in part to its neurophysiological effects and also a sense of spaciousness. So if people are experiencing something challenging, often what gets to happen is that it doesn't go away, but then they can experience it and see it with some space and distance and feel like, oh, I experienced this, but it's not me. And I've just found over and over again that to be so profound for people and so therapeutic and healing, to get that space and get that distance and have the opportunity to, I would say, really have agency over their identity and be able to update it should they choose to.
So you mentioned, people coming in with their challenges, or people, using this substance to heal. So I guess what we're, kind of getting at is, the title of this talk is Psychedelic Therapy and Trauma, and how those two are interrelated. So can you talk a little bit about different types of trauma, and which ones might be more suitable for this type of therapy, and kind of how it ultimately works to help people recover or heal from this trauma?
Absolutely. So the for me, there are kind of three pillars to this work. So there's safety, there's agency, and there's connection. And those are kind of the three domains, from this perspective, three domains that you could look at trauma from. Was it a rupture in terms of someone's feeling of safety in the world? Was it a rupture in terms of their feeling of agency and what they can do in the world? Or was it a rupture in terms of their connection to other people or connection to themselves? And one of the ways that I think ketamine can be so powerful is because it really can help elicit that sense of safety. So it has an effect to kind of route interpretation and association in the brain. So it goes less through those fear and survival centers. And essentially, what that allows people to do is engage something that has felt threatening, deeply threatening, with a feeling of less threat. So it's not as dangerous to them anymore. So they can kind of encounter it more objectively and in a different way. And when they're able to do that, their brain is able to reprocess it. And often what happens in trauma is something that happened in the past that felt to or actually did threaten our survival is experienced neurologically as if it's happening in the present. And so that's a common experience of, and a common sign of PTSD when someone says, I know that happened then, but it feels like it's happening right now. And anything that reminds me of that feels like it's happening right now. So the survival response gets to this place where they call outside the window of tolerance. So I can no longer feel regulated and make decisions in kind of a thoughtful or slow, rational way. It's actually very much a survival instinct scenario, even if that thing doesn't actually threaten your survival. And so one of the ways we look at that is with psychedelics in general, ketamine in particular, it has the ability to recalibrate that response. And so this thing that reminds you of that threat that happened long ago that maybe did threaten your survival, but this thing actually doesn't, that's happening present moment. Well, ketamine gives you the space neurologically to experience as, oh, that's not happening. The survival response is not necessary right now. And so when you can do that, your brain is actually able to process it in a way that it happened in the past, and your survival is no longer being threatened. And the outcome of that is people begin to experience themselves and life in a really different way. because they're not feeling that constant threat of survival. And so it can build resilience and also create a lot more adaptive functioning. And what I like to say to people is, this is not meant to take away your fear response. We still want people to have fear. It saves lives often, but it recalibrates it so it's really appropriate to whatever's happening in the present moment. So if you're walking on the edge of a cliff, yeah, definitely feel afraid and don't, pay attention. But if you're with friends or at a social gathering, it's then, and it is actually safe, that's a good situation in which to feel safe. And so psychedelics, and especially ketamine, can help process that. Or should I say, reprocess that.
Now, when you're in like a one-on-one situation, I can totally understand being able to personalize the guidance and the questions and the responses. But, when you're in a group setting, how do you kind of personalize the guidance and the experience without diluting, it too much? So I'm just curious how you navigate more of the group dynamics versus the one-on-one therapy.
It's a great question. So even for group work, I'll still do individual preparation, which each person. And preparation is just essentially connecting each individual with what it is they want to get out of the experience and what it is they want to bring to the experience. And so that involves intention setting, as well as setting some practices to have them connect to themselves before that experience. And so the individual preparation and individual integration, in my opinion, are really crucial, even after a group experience. What I will say, though, is I do tend to feel that for most people, a group psychedelic experience has the potential to be the kind of most powerful form of therapy. And there's something that happens when you do this work of consciousness expansion within a group that I think is synergistic and just truly amplifies the effects. And humans are communal beings, we're social beings, and so I think there's something that deeply works with our psychology and our nervous systems and our spiritual systems when we do this kind of healing work in a group. And what I tend to see is that it's can have even deeper effects over the individual therapy. That said, sometimes it's appropriate for someone to actually do some individual work before being in the group. For some people, it can be challenging to be in a group, and especially when there's that vulnerability and intimacy of we're all going to open ourselves up together and be willing to access this deeper place and even be willing to heal together. And so for some people, it can benefit really to do some individual sessions at first, whereas for other people, it can be totally appropriate to just have their first experiences be in a group.
Right. How do you decide what the dosage is for each individual? And then um, how do you incorporate sounds into the experience?
Great questions. So for dose, what I've learned and seen over time is that the dose response is truly individual. And there's an idea of weight-based dosing, so milligrams per kilogram. I haven't seen that to be consistent. And so what I'll do is everyone I'll work with, if I've never seen how they've experienced ketamine before, I'll always start them on what would be considered pretty low, or for some people, moderate dose. And then I'll check in after some time and I'll see how they respond, and then offer them the second dose based on how much deeper they want to go. So it's very much a collaborative process, as well as an assessment process. So that first small to medium dose, we're just going to see how you respond to this substance. And then once we do, okay, this is where you are. This is how deep it brought you. From here on, how much deeper do you want to go? Oh, I think I want to go a little deeper. I want to go a lot deeper. I'm not sure. Okay, why don't we wait a few more minutes and we'll figure it out. And so I prepare people. I always let them know that that conversation is going to happen beforehand. And I would say in 95% of cases, after that first dose, people are really clear. Oh, I know exactly where I want to go. And then I'm able to discern the dose from there based on how they responded to that first one. So it's really individual in my experience. And I think it it benefits from treating each person's metabolism and psychological experience of the substance as unique. And then what was the second question you asked, Max?
Sound. How do you incorporate sound into the journey?
Totally. Um, so I think it's pretty well agreed upon that music can be a profound part of a psychedelic journey. For some psychedelics, I think often, or I'd say in some cases, it's okay to do them and not listen to music. I'm sure many of people experienced, taking some mushrooms with their friends and going in the woods, and that's in itself is an amazing experience. I will say there's definitely sound there, right? And sound in nature has been well documented to have a really positive effect on our nervous system and psychology. So there's a lot of research about that. The birds went through the trees, etc. With something like ketamine, I actually feel that music is essential, and I would even say central. And so for ketamine specifically, the way I like to look at it is that in a way, the ketamine is almost a catalyst to the deep experience of music and the journey that the music takes you on. And so I like to say the music is the river that takes you along. And I found that to really be true for people. And so I'm very um, I'm very specific about what music to use and how and when and with whom. So I'll always take a lot of care for every session to really consider the arc of the playlist and the music. And in fact, most often, I won't just hit a playlist and press play. I'll have kind of these different palettes of songs, and then I'll see at which point each song might be appropriate for them. So some people call that live mixing, or it's kind of like a DJ set, but I found that to be the most effective and the most attuned way to support people on their journeys with music and sound.
DJ Mark. We'll now open it up for questions. So feel free to just drop any question you have in the chat, and we'll just go through them sequentially. And I'll jump in with a question or two that I'm sure will come up. But Greg asked a question around eye masks and interactions between participants during these sessions.
That's a great question, Greg. More and more as I do this work, I really have come to feel that eye masks, at least for kind of journeys with the intention of a therapeutic goal or an expansive goal, are really quite essential. And so for all the group ceremonies that I do, people are wearing eye masks as they're in their journey space and really feeling the effects of the medicine. But the groups I do also have, I do like to structure like a ceremony. So in circle, we'll have an opening of the ceremony where there's interaction. And then afterwards, we'll have a sharing circle where people get to begin to process and integrate a little bit. So, but while the medicine has kind of its effects, I would want people to wear the eye masks that whole time. And not everyone wants to, but for most people, it really helps.
Does everyone take the medicine simultaneously in the group setting?
Yes. Yeah.
Yeah,
Though I
that's
will say sometimes there have been some people that have chosen not to take the medicine and still participate in the ceremony and have also had deeply profound experiences. So
interesting. Do you ever have a situation where, a participant starts to channel something and speak out during the ceremony, and then it can interrupt, sort of the other participants' experience? And how do you handle those types of outbursts?
It's a great question. And that's something that initially when I started doing groups, I was concerned about. Oh, it's one person's expression disrupt another person's experience. And what I've seen happen over and over again, to the extent where I'm really not that worried about it, is that people either don't notice or respond so positively. And that could be laughter, that could be screaming, that could be crying, that could be wailing, deep grief. And there's initially there's that part that wanted to kind of silence that or be like, oh, you're being too loud. Someone else might be upset. But I found that was a really limited view. And I think is probably a little bit culturally constructed, because what ends up happening is in the sharing circle after, someone said, I loved when I heard you laughed, that opened up something for me. Or I heard you cry and I just was sending you so much love and I wanted to take care of you. Or even someone who was right next to another person, this person was screaming out loud. It's like, oh, how was that for you? I didn't hear them at all. And so it's either neutral or positive. I would say 99% of the time. And what I've learned from that is actually people's expression not only don't disturb other people, but often help them. And they'll either help with their healing or learning something or empathy. And so at this point, I feel that expression is totally encouraged. It, again, is almost never disruptive.
Beautiful. So Racheli writes that she feels like many people lead ceremonies these days. How would you say someone is qualified or trustworthy to lead? And do you consider what you're doing ceremonial, or do you consider what you're doing, just under the moniker of group therapy? Maybe help us distinguish between those two.
Great question. So I think I can talk about my influences from that perspective. So I don't consider what I do religious. Um, but I heard a definition of spirituality one time from Sam Harris that I really liked, which is spirituality is having a rich inner life. And I love that because you can not believe in God and have a rich inner life, or you can believe in God and have a rich inner life, or whatever it is. It just is an experience of the world and of our own consciousness that actually doesn't require any other set of, religion or framework or values. And so which to me, what that means is that it's open to all of them. And that's kind of my approach, is I really want to be open to all people. So what I want to do is set a really intentional space, so that, in a really safe space, so that people can feel really welcome and safe to connect to and express themselves in any way that feels authentic and healing. And I do believe that ceremony is a good way to do that. Ceremony being a structure that's placed around time to set a container in time that says, from this time to this time, we are in this space where we can feel safe connecting to and expressing ourselves. And so from that perspective, I do have a structure, which I call a ceremony, to provide that container. And then to your second question, just in terms of how would you say someone is qualified or trustworthy? Actually, I'll go back a second. Some of my influences have come from ceremony, even religious ceremonies. So, I had the opportunity to do ayahuasca in Peru in 2011, and that taught me so much about how to set and create that intentional space. To be in a circle, to be in a room that was really intentional, and the idea of sacred being something that we all hold as valuable. May be religious, may not be, but just the idea of something being sacred is something that we have a deep and utmost respect for. And for me, that respect is really about humanity, each individual's humanity. And so how would I say someone is qualified or trustworthy to lead a ceremony? If they are someone who respects and honors each other, anyone else's humanity, that's what I would say is the main qualification. I had a teacher once that said, pay attention to someone's humility as well. And so I think also perhaps humility could be a really good quality in someone who's leading a ceremony. So that is maybe how I would answer that question, Racheli.
If somebody is, saying things like, this is going to be the greatest experience you've ever had, or this is going to change your life, or this is going to be worth every penny, is that a red flag when someone kind of uses that language?
I think that is probably not the most responsible way to set someone's expectations. I usually tell people that it is the beginning of a process that may last their entire lives even.
Mm-hmm.
That's the opportunity. And so when people ask, oh, how many should I do to get the benefit? I encourage them to be willing to start with 3. This is for ketamine specifically. Willing to start with 3, and then we'll have a good idea, right? That's just kind of the assessment phase. Often I know after 2, and there's some people even that have a ketamine session and they feel like, that's it, I'm good. I got what I want. My life has changed here on out.
Mm-hmm.
That happens, but it's rare. And some people that happens to, and they're set for until I hear from them again. And for some people, 2 weeks later, I thought I was totally cured or whatever, but now all the symptoms are coming back. I need to do more. So that's why I always encourage people to be willing to do at least 3. And especially the integration is really what I found to be the most important part. So even if you're only going to do 1 ever and you've made that decision, be willing to do as many integration sessions as it takes to really have the benefit be lasting. And so I think expectation setting is a responsible thing to do for people, and not promise that any one thing could help or cure them. Because for some people, they actually even have really challenging experiences. I'd say it's the minority of people, especially with ketamine. When we're talking about other psychedelics, I've had a few myself that have taken years to process. That's how challenging they've been. And so I think it's important to let people know that there could be some challenge here. And this is not a one and done thing. This is really the beginning of an approach to yourself and a path that you may be walking on for a while.
Beautiful. Now the questions are streaming in. So, Shelley and John both are kind of wondering about the Matthew Perry incident, and just kind of, maybe the neuroscience of the compound, how it attaches to receptors, its addictive properties, if any, how it impairs decision making. So maybe if you would like to comment on that whole recent current event, and just help us understand the science better.
Oh, that's a really great question. I'm so glad you asked. Where do I start? I think I'll start with kind of the messaging that's come around it. I feel that the reporting has been sensational at least, and maybe irresponsible at worst. There's this, I took a picture of it on my phone just because it stood out so much. I'll just read it. Oh yeah, here's a quote from one of the articles. The cause of death for 54-year-old actor Matthew Langford Perry was the acute effects of ketamine. Contributing factors in Mr. Perry's death include drowning, coronary artery disease, and the effects of buprenorphine used to treat opioid use disorder. What's interesting about that is that it says the cause of death was ketamine, contributing factors including drowning. It's kind of like saying the cause of this person's death was alcohol, contributing factor was they fell out of a 40-story balcony. So it's just those things alone kind of give a little bit of insight as to the spin that's going on here. Also, the effects of buprenorphine used to treat opioid use disorder. So buprenorphine is an opioid. And I think the main point I want to talk about there is some of the articles are reporting that ketamine caused respiratory depression. So basically that's your breathing slows down to the point that you might not be breathing anymore. Ketamine doesn't actually do that. It does something quite the opposite, called it preserving respiratory drive. That's why they started using it in anesthesia. That's why they used it as an anesthetic in the war, in Vietnam War. They called it the buddy drug because you could inject someone with a lot of ketamine. And unlike morphine, which was the main anesthetic at the time, which could cause respiratory depression, possibly to the point of death, ketamine preserved respiratory drive. So you didn't need a medical license. Anyone could carry a syringe of ketamine on them, inject their buddy on the field, carry them off, and that person would be anesthetized in much less pain. So that's just kind of a major misinformation in the article. So I just wanted to kind of cover those first, but I will say that it's not benign, right? There can be risk involved. That's why we want to do ketamine in a really safe place with people. We don't want people to take a lot of ketamine and then walk out on the street and feel the sense of safety as they're trying to cross the street, but not looking both ways. That's dangerous. We don't want someone to get in their car on a lot of ketamine. Likewise, we don't really want someone to go near a body of water with ketamine because it can induce an anesthetic state. So there is a possibility of someone, Matthew Perry or someone, taking a lot of ketamine, losing consciousness, and then being submerged and not regaining it in time. And that's how they drown. I wouldn't say the cause of death was ketamine there. I'd say it's drowning and asphyxiation. So there is an amount of ketamine that you can take where you would kind of lose consciousness and not be able to regain it. And that's called an anesthetic dose. And typically in therapy, we work at what's called a sub-anesthetic dose. So just to give you an idea, the amount of ketamine I work with in a given therapy session, even at its highest doses, is often 10 or 20 times less than what someone would get for anesthesia. And so it's really on a different order of magnitude. And so for Matthew to have had an anesthetic dose of ketamine to the point where he would lose consciousness and not regain it would just be an incredible amount. Probably more than you or I would likely ever encounter in a therapeutic session. Maybe not. Maybe he was extremely sensitive. I don't think so, because he'd been doing IV ketamine therapy at clinics and had a prescription for at-home ketamine therapies for sublingual lozenges. But he would have had to, I can't imagine how many lozenges he would have had to take to get to the state where he would have lost consciousness and not regained it, unless it was combined with some other substances, for example, an opiate like buprenorphine. So I can see how someone could take a bunch of substances, enough to lose consciousness, be fully submerged, and drown in the hot tub. And that's, in my opinion, likely what happened.
How does it affect your decision-making in general?
How does what affect my decision-making?
Not your decision-making, but ketamine affecting
Oh,
decision.
that's a good question. So, I mean, ideally, you take ketamine in a setting where you wouldn't really have to make too many decisions, which would be a therapeutic session. You know, some psychedelics, I think, have that effect where you can do other things, right? Like you can go to a rave and take acid and dance all night, and that can happen. Ketamine, I think, is best used when really you're lying down, you have an eye mask on, and you're listening to the music. That's, I think, the thing, because it reduces your visual acuity, so things are blurrier. It impairs your balance. and kind of ability to walk and mobility. So you really want to be still and just being and present. So while you're on ketamine, I think it can maybe affect decision making in a similar way that taking a lot of alcohol or opiates or whatever it is. So kind of reducing that um, prefrontal cortex processing, reducing the limbic system, so the kind of the survival area processing. So you definitely don't want to make, operate heavy machinery on something like ketamine, which, I'd say is consistent across all the psychedelics. Um, but in terms of like the day after, for example, a lot of people say it provides a level of clarity, of confidence, of ease. And so what I've noticed in the days and weeks following is that people tend to make decisions that they appreciate and that benefit them. Um, but again, while you're on ketamine, maybe best thing to do is be in a situation where you actually don't have to make that many decisions or move that much.
How about traumatic brain injuries? How would these experiences interface with someone who, maybe was hit by a car or otherwise and is on a path to healing their brain?
So they used to avoid using ketamine in traumatic brain injuries, TBI, because they were worried that increased intracranial pressure and could cause, exacerbate the damage, the already damaged parts of the brain. But a number of years ago, I'm not sure exactly when, that actually changed. And paramedics started giving it to people who had been in car accidents. And the reason is because it actually preserves vascular blood flow in the brain. And so it can reduce traumatic brain injuries later on. And so they realized that what they were afraid of actually was helping people. And so now there's a lot of great research showing that closely following or even a long time afterwards, something like ketamine can be really helpful for TBI and brain injury. And the reason is twofold. One, it helps with the blood flow to the brain. And two, it's one of the few things that can really help with neuroinflammation, which can be pretty hard to get to. And so there's whole clinics devoted to rehabilitation from traumatic brain injury that have ketamine as a large part of their protocol.
Now, a lot of people use ketamine recreationally. They'll snort it as a powder, or they'll do it as a lozenge. Typically, you don't see IVs at parties, but there's a lot of people who I would say are addicted to it as like a way to socialize. And I'm just curious to get your take on, sort of the darker sides of ketamine and maybe some of the risks of ketamine, and depending on, how you consume it, how the risks can vary.
Totally. I'd say intranasal carries the highest risk of dependency. So doing lines, nasal spray, that kind of stuff. Um, that's what I've seen. And I've even worked with people who have used it recreationally, regularly. And I'd been hesitant about whether to prescribe them some, but as a matter of harm reduction, hey, listen, if you're going to do this, as part of their course of treatment, right, for depression or whatever, because often we'll prescribe some for at-home use, which can help sustain the effects between the in-office use and also reduce the costs, so they don't need to come in office as often. And I asked the patient, I said, "Oh, have you been using the ketamine I prescribed you recreationally?" And she said, "I haven't." And I said, "Why not? I think it is probably safer, even though I'm not recommending that you do it, but just from a harm reduction perspective, if you're going to use ketamine, safer to use the pharmaceutical stuff than the stuff off the street." And she said, it feels different. This stuff comes from you, and I want to respect it as that, and I don't want to use it in that way. And when I'm at parties, I like to, do the powder more. And so that was really memorable for me because what I have found is that when people get prescriptions for ketamine, they don't tend to become dependent. Now, I've worked with people who that's more of a risk because they have a history of substance use dependence, and so will maybe have more of a risk of using it that way. But I haven't seen it as much of the sublingual, so the lozenges, which is understandable because you have to swish it in your mouth for 10 or 15 minutes. It's a lot less convenient. You can't talk to people. It comes on a lot slower. So I would say the real risk of dependence is for the intranasal route. And I think another reason of that also is because you can just do a little bit and it lasts a much shorter time and you can have a much lower experience and you can kind of be more functional. You're not like taking something in your mouth, it's there for 15 minutes. You're getting deep into this journey. It's like hard to balance. It's like you can be more functional. And so when you can do a substance and be kind of functional and it helps you feel better, that's when we start seeing the potential for dependency. Ketamine, it's worth noting that ketamine is a Schedule 3 substance. And so what that means, it has some potential, it has a recognized medical use and some potential for dependency. Other substances like Adderall, Ritalin, modafinil, all the opiates, or most of them at least, are Schedule 2. So that's medical use with a high potential for addiction. So it's considered to be have less of an addictive potential than a lot of drugs that a lot of people are on. But that doesn't mean that people can't find a way to be dependent on it. And the way I understand that is, if you're taking something and you can function and it helps you feel better, it's like there's an incentive to take that more. And I think I saw a question about how does it act on the dopamine system? It has some action, but not really in as direct a way as something like Adderall, which acts directly on the dopamine system and like fires a lot more out. But I think people have that dopamine spike in association with the feeling of like, oh, I feel safe and good in the world. And so that's where I see the potential being. And the harm I see is, just the harm of being dependent on any substance, but also that, a lot of the street drugs, there's a real risk to them these days, right? There's the fentanyl going around, and unfortunately, there are more and more deaths from contaminated substances. So, if you can get a pharmaceutical grade of it, it's really much safer.
Got it. Well, we're just bumping up on the final few minutes, so maybe we can just do a little futuristic take, from your perspective, kind of where does this all lead to? Where is this all going? And what's kind of your vision for psychedelic therapy as it relates to humanity?
I think that a lot of people could get a lot of benefit from psychedelic therapy. And that could be with substances or it could be without. But there's something to me about a willingness to take time out from your ordinary life. As one of my mentors, Phil Wolfson, says, a time out from ordinary mind, to connect with yourself. And as well as a willingness to go into a place of uncertainty and the courage that takes and the vulnerability that takes. And then to have that renewed experience of yourself and a renewed perspective of the world, and then to be able to weave that into your day-to-day life, to me is, from what I've seen over and over again, a truly, and experience myself, a truly beneficial process. And so whether that is catalyzed by substances or whether that's done with some other method to access that place, I think the approach to psychedelic therapy is really beneficial. And it seems that it's getting more and more of an acceptance. And I hope it continues to, because I really see it helping people. Is it okay if I speak about a project that I'm going to do that I'm excited about?
Yeah, let's do it.
There's is of course an issue of accessibility because it takes a lot of time, and especially to do with trained people, that can cost money. And so I've been working with a a business partner in LA for a number of years who's also a therapist. And we are planning on opening a community ketamine clinic in Echo Park. We think it's the first one in the country. And our goal is to offer low-cost ketamine therapy. And we're really excited about that. We're not sure if the model can work, but we're willing to give it some time to see if it can work. And so that is part of my hope and my vision, that this kind of work will become more and more accessible. And hopefully, if we can do it well, other people will take that example and follow suit, and that it will become more accessible to more people.
Amazing. Well, Mark, this has been a very interesting, insightful, thoughtful, stimulating conversation. So we're really grateful for you, for your willingness to take the time to share all of your insights. It seems like a giraffe group therapy session is in the making. So more updates on that as well. Stay tuned. And to everyone who's joining us for this fireside chat, thank you so much. We're looking forward to next week.
Thanks so much, Max, and everyone else for your great questions and engagement.
Bye, everyone.